Hi, it's Jonathan Robinson at Able Orthotics, Certified Pit Orthist. I'm here today to talk about diabetes and the importance of prevention with regards to maintaining good foot health. Some of the things that we do here at Able Orthotics, we always like to give information to our patients because that's helpful. This brochure is called Living with Diabetes, and it outlines two of the main complications that people who suffer from the long-term effects of diabetes can be affected by. The first is peripheral neuropathy, or reduced sensation in your feet and legs. The second is peripheral vascular disease, which is reduced circulation. So in one case you have less feeling, and in one case you have less blood supply, and therefore reduced healing. In both cases, the at-risk foot can become very complicated for people with diabetes. The number one reason for hospital stay in Canada for persons living with diabetes is foot ulcers. It's important that you maintain good health for your feet, and that will keep you out of the hospital and upright and managing your quality of life. I brought a shoe in today to show you some things that are characteristics of a shoe that will be appropriate for someone with diabetes. A removable liner is very helpful. This shoe also has a full soft lining on the inside, and what that means is that the shoe is designed to break down instead of breaking down the skin in your foot. This shoe also has no seams and an adjustable closure or laces or Velcro. This is critical because your foot sliding around in the shoe can produce lots of trauma, and that's very problematic. We want your foot well fitted in the shoe, and we want the shoe so that it's protecting your foot from any kind of pressure or problems from the outside, trauma or stress from the shoe. And then we also want your foot inside and protected from anything that might fall inside, which is why a good critical closure is important. Something that closes well is very critical. One thing people with diabetes should do on a daily basis, take the liners out of your shoe, look for blood or any other kind of discharge that might be on the insole. That's going to tell you that something is not right with your foot. Very critical that your family doctor or your physician specialist is looking at your foot every time you're in the office. Just a quick tip, slip your shoes on and socks off before the doctor even gets in there as a reminder for them to look at it. That way she'll be sure to have a look and make sure that everything is going well for you. It's important to take the pulse on the foot to make sure that circulation is good, and it's also important to check for sensation on the foot. And there are filaments that we use to check and make sure that your circulation is good, your sensation is good, so that we know that if you're at risk or not. One of the challenges for people living with diabetes, sometimes people think that they're doing really well. My feet haven't felt this great in ages. The reason they feel good is because you have no feeling, and so the alarms are turned off, if you will, and you're not getting the message that you are in trouble. Just as if you had no feeling in your hand and you put it on a hot stove, you would burn your hand, but you wouldn't know until you smelled the flesh burning. The warning signals are off, and that's one of the greatest risks for people with diabetes. Generally, it's a short, quick interlude that either is from a bad choice or maybe mismanagement or a mistake that people don't intend to make that leads to a long-term complication. Prevention is so critical and definitely minimizes the negative outcomes of the disease.